अमिताभ और आप देख रहे हैं मेरे साथ एड टॉक विद अमिताभ। और जैसा कि हमने वायदा किया है, हर एपिसोड में हम आपको एक ऐसी शख्सियत से रूबरू कराएंगे जिसका समाज पर एक अमिट छाप हो। पिछले 10 एपिसोड्स में हम आपको देश के विभिन्न प्रांतों में लेकर के गए। वहां से हम एक एक्स प्रोफेशनल को सामने लेकर के आए जिनके लाइफ एंड टाइम से हमको बहुत कुछ सीखने को मिला। बीइंग अ साइकोलॉजिस्ट, पिछले कुछ एक समय से हम लोग ऑनलाइन काउंसलिंग्स कर रहे हैं, लोगों को जिस भी तरीके से हेल्प पहुंचा सक रहे हैं। माय टीम एट HLS इंडिया इज प्रोवाइडिंग लॉट ऑफ सपोर्ट। और इसी दौरान हमारे पास इस तरीके की बहुत क्वेरीज आई हैं, पेरेंट्स के पास से बहुत सवाल आए हैं। बहुत सारे यंग पेरेंट्स आर वेरी एंक्शियस कि ये जो कोरोना है, कोविड-19 है, इसमें बच्चों के लिए हमारे आपके समझने के लिए क्या चीज है। एज अ साइकोलॉजिस्ट ऑन अ एंजाइटी फ्रंट, एज अ साइकोलॉजिकल फ्रंट, जो भी हमें जानकारी है वो हमने शेयर करी, काउंसलिंग हमने प्रोवाइड करी। लेकिन हमें लगा कि जहां तक मेडिकल पर्सपेक्टिव का सवाल है, उसके लिए इफ वी हैव अ मेडिकल प्रोफेशनल विद अस, दैट विल बी आइडियल टू गेट अ रिसोर्स who knows it, what is medically correct for kids and for children and for parents. And friends, we have also, because we are associated with a large segment of schools as our client base and friend and associates, today's episode is being specifically watched by many parents from various schools, and specifically we have two schools who are officially simulcasting as a watch party today. We have Jan International School in Kanpur, which is simultaneously running the watch party of this show, this episode. And we have Jan Word School in Mati doing the watch party simulcast along with the show. We also have in Kolkata, Delhi Public School in Howrah, which is also doing a simulcasting of the watch party for the benefit of their parents and for the society. So a lot of parents will be watching, and I'm sure we all will benefit with the same. So having said that, friends, our guest for today is a celebrated pediatrician and neonatologist from Kolkata, Dr. Vijay Kejriwal. So without any further delay, he is connected to us in our virtual studio, waiting to go live on screen, be with all of you and answer our queries. So we have Namaskar, Dr. Saab. Welcome to Ed Talks with Amitabh.
Namaskar.
Thank you so much for accepting to be us. I know is समय. First of all, allow me to extend my salute to you as a doctor, being a COVID warrior. हम लोग शायद इस लॉकडाउन में हमारी सोच बदल गई है कि पैट्रियट सिर्फ वो नहीं होते जो सरहद पे खड़े होते हैं. Everyone who's committed and rises to the need of the hour to serve the nation. And I think doctors and paramedics and teachers have shown that what they mean to the whole society and to the whole world. So thank you for being a doctor, and thank you for taking the challenge and helping all of us in these COVID-19 days.
Thank you, dear Amitabh, for your nice introduction. And thank you for taking the initiative for inviting me for this ED Talks, School Times, ED Talks with Amitabh. I am so very excited and I am ready to answer all your queries. As regards your tribute to COVID warriors,
Right.
My opinion is each and every citizen of India is a COVID warrior, and he is contributing in some way or other to prevent this infection from spreading.
Thank you for so beautifully saying that every citizen is a COVID warrior, because we all have our role to play in this battle, in this war. क्योंकि अगर हम संयम रखेंगे और घर में रहेंगे, we are making a huge contribution as a COVID warrior as well. Dr. Saab, with your permission, can we start our journey by knowing your life journey?
My?
हम लोग थोड़ा सा चाहेंगे इससे पहले कि हम लोग कोविड और इसके बारे में हम लोग I forgot to put my charger on the I think so now
Hello. Hello, hello.
In this lockdown days, before we come to the medical queries, we already have started people putting up the query. That's the power of having a doctor on. Just give me a minute. I think working from home has
So,
its own situation. I think we are connected. There will be no disturbance now. So, Doctor, basically, हम चाहते हैं कि इससे पहले कि हम मेडिकल कंटेक्स्ट में बात करें, I would like to ask. There are a lot of people. इस समय एक और सवाल आ रहा है. कुछ लोग सोच रहे हैं भाई डॉक्टर हैं हम तो बड़ा मुसीबत में हैं, और कुछ लोग सोच रहे हैं कि हम डॉक्टर क्यों नहीं हैं, अगर हम होते तो हम डॉक्टर्स की तरह से देश की सेवा so we would like to know from your life and times. I know आपने अपनी एजुकेशन अर्ली एजुकेशन आपने यूपी से मिर्जापुर से शुरू करी, and then you came to then you did your medical from went on to do your post graduate was in Georgia, which is one of the first. इसके बारे में हम जानना चाहेंगे that how did you decide to be a doctor, and what is it like to be a doctor before we go into the corona and kids as our main theme today.
as because my profession is concerned, as a doctor, I am feeling proud and I am feeling blessed.
Right,
Can you hear me? I am feeling proud and I am feeling blessed today
right,
in this context.
right,
Okay.
right.
My journey started, I had my primary education in Mirzapur, UP.
Okay.
Then I schooling I had from Raniganj, West Bengal. Then I did my graduation, MBBS and diploma from Kolkata,
J.
and my post graduation from KGMC Lucknow.
Okay.
This is in short how I traveled.
Right.
And as my profession, you can say I'm really blessed by God
Right.
that I have the opportunity to take care of the families which I serve, or I am serving the nation.
Uh,
I am proud. I am proud for it.
so good to hear that, Dr. Saab. I would like इस समय जो डॉक्टर्स की जिंदगी, हम लोग अपनी जिंदगी बचाने के जद्दोजहद में लगे हुए हैं, और आप अपनी जिंदगी को दांव पे लगा के आप हॉस्पिटल भी जा रहे हैं, मेडिकल सेंटर्स में जा रहे हैं. You have your medical unit in Calcutta, I know, in one of the first state of the art hospital in Havra Lilwa area. You are coming out. So as a doctor, what is your challenge in these days, and how do you keep yourself positive during these times?
Yes. Number one, I am not scared.
Okay.
I am not scared
See?
because the first point, you stay informed. If you are staying informed of the developments,
Right.
and you know the disease and you know the virus and you know the precautions you want to take,
Right.
then the idea is only two:
Right.
do your best and forget the rest.
Okay. Okay. So you
And and be generous with your smile. You got my point. So
right.
you take,
Right.
with all taking due precautions. If
Right.
something happens,
Right.
if something happens, then it is a professional hazard. Each profession is having such hazards. Our police force is having,
Right.
media persons are having.
Right.
So do we. So are we. So there is nothing new in that. So that is
So
my opinion regarding this.
you as a doctor, as an individual, have that spirit. But then,
Yeah, yeah.
how's your family coping up? How's your better half and your children when you go to hospital and you come back? How's the dynamics there?
Dynamics, very, very delicate dynamics.
Okay, okay,
They are scared when I go out
right,
कि आपको war zone में भेज रहे हैं. I'm just
right,
family saying आपको war zone में भेज रहे हैं. You should not go. My duty tells me to go,
right,
and they are definitely scared. I just
right,
assure them that I am taking all precautions,
right,
and at this particular time, I have a moral duty, professional duty to perform,
right,
and I should give my best. And they are supporting me like anything.
right, right.
And I think that's enough.
So there is a natural family anxiety, but they are very supportive of the initiative that you're
Yeah.
doing and the challenge of saving others' life.
Yes.
Dr.
Yes.
Saab, was so beautiful to hear that. And I would like to emphasize, Dr. Saab just now mentioned, friends, for all of us, how he's coping up and the lesson that I've learned from our interaction so far. Be informed. Information is power. अगर आप सही जानकारी अपने पास रखेंगे तो आपको डरने की वजह कम होंगी, आपको वो ताकत मिलेगी जो आपको इस डर से दूर रखेगी, इस एंजाइटी से दूर रखेगी. And that is why I would also urge to all of you, friends, इतने सारे मीडियम ऑफ इंफॉर्मेशन आज की तारीख में है. वी ऑल आर लिविंग इन इंफॉर्मेशन एरा. It is also very important to choose the right source of information. Friends, when it comes to medical advisory, even we dare not casually talk about it. कि ये कर लो तो बहुत अच्छा होगा. No matter how well read we are or well acquainted we are, only the qualified professional and the right sources should talk about it. And that is why we have requested Dr. Vijay Kejriwal, a celebrated pediatrician and neonatologist, uh, who has all the right answers for us to settle down our medical anxieties. And when the medical, right now medical anxiety is leading to the psychological anxiety as well. So right now you have a doctor and a psychologist with you. We'll try
Mhm.
our best to get you the right information from our perspectives. So Doctor, I would like to ask that as a parent, what should people right now know about corona? In fact, I'm also a parent of a teenage daughter and a 7-year-old son. And अभी बीच में जब ये लॉकडाउन हुआ तो जुकाम भी हो गया. तो नेचुरली एक अंदर से मन में एंजाइटी आई. जो भी हम लोग घरेलू नुस्खे जो कर सकते हैं उनको यूज किया. एंड और लेकिन जब तक कि वापस जुकाम ठीक नहीं हो गया, खांसी ठीक नहीं हो गई, मन में ये एंजाइटी भी रही, भय भी रहा, ये भी रहा कि भाई किसी को बताएं कि ना बताएं, कहीं कुछ सही गलत हो जाए. सो हाउ कैन पेरेंट्स differentiate between corona? What do we need to know about corona, and how can we differentiate corona with the uh, other normal symptoms that we otherwise can also have,
Let me be very positive.
right?
First of all, start positives. Okay.
Okay.
So number one, as regards kids are concerned, kids.
Right.
I'm just talking of kids.
G.
Corona is kind to kids.
Okay.
Okay. Kids are less involved.
Okay.
If they are
Okay.
at all involved, they have mild symptoms
Okay. Okay.
and they recover early.
All right. So
There are
before you go further, Dr. Saab, I would like to emphasize on what you said. Friends, Dr. Vijay Kejriwal says Corona is generally kind to kids, and it is there are and they also recover faster. They have the capacity to battle with the virus, you know, much more than many other people in different age groups. Okay, Doctor.
two, 3 points I can just explain to our learned parents.
Okay.
In playgroup school, in toddler age, in schools, they are more exposed to respiratory viruses than general population,
Okay.
and they have antibodies. So
Right.
that helps as a cross immunity with other viruses also.
Okay. Okay.
Number two, they are all well immunized. Almost
Okay.
all
Okay.
kids are immunized against BCG, against oral polio, against measles, and
Right.
some other vaccinations.
Right.
So
Right.
a protected child is in a better position to fight other viruses.
Right. Right. Right.
And number three, one scientific thing I am just explaining for your
G.
learned parents, that in children there are upper respiratory tract and lower respiratory tract.
Okay.
Lower respiratory tract involvement causes pneumonia,
Okay.
and upper respiratory tract causes mild flu or say cough-like symptoms.
Okay.
So corona, when enters into the cell,
Right.
it is in need of a receptor called ACE2.
Okay. Okay,
It
ACE2.
ACE2.
Okay,
So it attaches to the receptor on the
right,
surface of the human cell
right,
and then enters the cell and destroys it, replicates and destroys.
okay, okay,
In children, these
right.
receptors are less in number in the lower respiratory tract cells.
Okay, okay, okay. So that is a good news. I mean, because they
Uh,
have lesser number of receptors, so susceptibility also may be lesser.
of their going critical is lesser.
Okay, okay,
They usually it subsides say some mild flu, mild fever. This I'm talking general. I'm talking. I will talk in detail
it
later
is
on.
right, right,
Just to assure you.
right.
And the second part of question was to take. Just you think that all cough and cold are not corona,
Okay, okay. All cough and cold is not corona.
not corona.
Right,
There are common cold viruses.
right,
There are influenza viruses.
right,
There are seasonal allergies,
right.
and then come corona.
Okay, okay,
Got my point. So all respiratory symptoms are not corona,
right.
and you can get corona even if you have no symptoms.
All right. So there is a possibility that even without symptom, there's a
Yeah.
right. Okay, okay,
Yes. Yes.
okay. So, Doctor, how what precautions can parents take? I mean, symptoms still gives us the anxiety. Now, this also is a challenge that it can happen even without symptoms.
Yeah.
It can be asymptomatic,
Yeah. Yeah.
right?
Particularly as because you asked for precautions or prevention.
Right,
So the foremost precaution that with children you can take is
right,
personal hygiene.
right, right,
Personal hygiene. This is your personal protection, say distancing, social distancing,
right,
and wearing of mask,
right,
avoiding gatherings
right.
or avoiding crowded places,
All right,
and this washing of hands, frequent and thorough washing of hands,
right,
then the use of sanitizers,
right,
which everybody knows. I am just
right,
emphasizing it. That avoiding gathering and
right,
avoiding crowded places and
right.
avoiding contact with persons who are having flu-like symptoms.
So avoiding contact with people who have flu-like symptoms because you don't know which flu is
Yes,
corona,
yes,
which one is not. So in general,
yes, yes,
avoiding contact with them.
yes. Avoiding contact. Then
Right,
supposing say hand hygiene is very important.
right,
Frequent and thorough hand washing with soap and water. We
right,
have such an instrument against corona,
right,
simple soap and water.
right,
If we can follow some etiquettes, supposing after waking up in the morning,
right,
we wash our hands thoroughly for at least 20 seconds.
right, right,
Then supposing after coming from toilet we can wash our hands.
right,
Then if before eating and after eating we can wash our hands.
right,
Before going to bed we can wash our hands or wash the hands of our kids.
right,
And once the lockdown is lifted,
right,
then whoever is coming in the house
G,
from outside,
right,
be it our kids, be our parents, grandparents, or anybody,
right.
they should follow the protocol before entering the house.
Okay, okay,
Either the hand wash is a must, but if
right,
you can take bath before
right,
entering the your house,
right.
nothing like that.
I think that that would be very, very essential in times to come and even right now.
Because during lockdown period, this is not such a problem because
Right.
already 14 days quarantine everybody has had.
Right. In fact, Dr. Saab, on a lighter note side, I was talking to some of the fellow psychologists, and we were saying that the one of the very popular symptoms of OCD, obsessive compulsive disorder, is constant obsessive cleaning hand washing and all becomes a very important tick as a symptom. And we were saying probably now even the association will have to review because everyone would be washing hands every minute, every half an hour, so it cannot be treated as obsessive anymore.
I just want to share with you. Everybody says so many parents ask me and they're saying they are washing hands every 20 minutes.
Right,
I am saying you need not wash every 20 minutes.
Okay.
You just follow what your parents and grandparents advising you for last so many years.
Right.
After
Okay.
waking up, after waking up, after coming from toilet, before eating, after eating,
Okay.
before coming to entering home, our parents, our grandparents, they advise all these,
Right.
and we Indians are almost following also. So
So
we will not have that much of difficulty, and that we must not be obsessive about hand washing.
so we need to get back to the Dadi Ma and Dadaji ke nuskhe for
Yes,
basic guidelines for healthy lifestyle that we have always been given will be very, very important for children, as Dr. Saab points out. That is, few basic hygiene habits, as Dr. Saab just now pointed out, wake up before and after the meal, before going off to sleep, when you enter the house, when you're going out of the house, are some of the basic habits that our elders have been always trying to guide us, is what we need to take up. And Doctor, now this also brings us that how when should a parent think of consulting a doctor, thinking that I now cannot differentiate within myself that whether it is corona or it is going beyond that. So what can be the guidelines for parents that हमको कब ये decision लें, when can we take a decision कि भाई ये हमको अब अपना दिमाग नहीं लगाना चाहिए, it's time to take the child to the doctor.
okay. First of all, the parents should know any travel history is there or not. Somebody in their homes have come from abroad or not.
जी
Number one.
जी
Second is there any flu-like symptoms any person is having?
जी
That is also important.
okay
As regards symptom of the child is concerned,
right
supposing nasal running of nose, sore
right
throat,
right
temperature, high grade temperature, then
right
cough and cold.
right
These can be common to all these things, common to all
right
viruses. Okay,
right
but
right
if the temperature persists,
right
if the dry cough persists,
right
and if there is respiratory embarrassment, you are having feeling that you are having some difficulty, say early difficulty in taking breathing.
right
So any persistent thing or
right
any aggressive behavior, supposing you have
okay
mild and it is going on, you that
right
no, it is 2 3 days the child has a high fever also,
right
incessant cough, some
right
respiratory or some irritability,
right
or appetite is down, or
right
supposing some loss of taste, or
right
say loss of smell, or
okay
say body ache, or say
okay okay
cramps,
okay
or some associated loose motion vomiting.
okay okay
What are these symptoms and warning signals? So you be alert
okay
and
okay
you consult the medical professional. But
right
even that stage, I will
right
advise you first consult over telephonic consultation, online
okay
consultation.
okay
Not
okay
to online consultation. Supposing if the doctor in online video consultation you can have, if
right
the doctor can assure you that nothing to
right
worry, then
right
you can keep monitoring the child.
okay okay okay
Ultimately you will have to take precautions, keep the child separate
right
without consulting doctor also. You just keep
right
the child separate. You
right
just above 2 years you allow the child to wear the mask.
right
You tell the child that hand hygiene, whatever
right
I told you. Then
right
sanitization of frequently touched surfaces, regular
sanitization of frequently touched surfaces,
touched surfaces or objects, both
objects, right
objects and surfaces.
right right
Which whatever solution recommended. So if
right
you these all these you'll have to start doing,
right
and then consult your healthcare personnel on telephonic consultation, online. Don't rush to the clinic,
right
and
right
supposing and keep in touch.
right
And now, if you see that the symptoms are aggravating, then ultimately you'll have to whatever
right
your consultant advise, you will have to go there.
okay. So doctor, what I could make out for validation and emphasis from you, uh, you need to see if there is a persistent symptom like dry cough, fever, or any associated symptom like loss of smell or diarrhea, or if that is coming, that is the time when you should not at all take it lightly and get in touch with the doctor. And doctor says that if the symptom is getting aggressive, that is also a time when you need to is becoming rigid and becoming aggressive, is the time when you need to get in consultation with a doctor, your child specialist, or a physician. And he also has very importantly pointed out, on the first go itself you don't have to take an appointment and go. I mean, डॉक्टर से मिलने की तसल्ली की जरूरत नहीं है. अगर डॉक्टर आपको ऑनलाइन कंसल्टेशन दे सकता है और डॉक्टर इज कन्विंस कि भाई अभी मिलने की जरूरत नहीं है, डॉक्टर विल बी एबल टू यूज a discretion ki whether physical checkup is required or not. If it is just on a consultative guidelines, it can be taken care of. One should go for that as a first step. And if doctor says no, examination is required, only then take an appointment and visit the doctor. That is very, very important to keep in mind. So, Doctor, I'll take your permission and encourage our audience at this point of time. Friends, we have the privilege of having Dr. Vijay Kejriwal, a pediatrician and a neonatologist, an expert. Feel free to ask all your medical queries related to your children. Generally, they would be applicable to grown-ups as well, but then our focus in the show is Corona and kids. So feel free to ask your medical and psychological anxieties related to Corona. I'll be looking at the our chat box to see if we have questions. But sir, before I take a further question, I could see that a lot of people have already started joining our interaction, and we have Rajesh Sarda, Suman Morarka, Prahlad Bagla, Anup Padepuria. There are many people have joined. Mukesh Sharma, Tiyasha Sarkar Bose, Neelam Chandra, Priyanka Das. So we have a lot of people join. We'll I would welcome everyone who's present here and feel free to ask your question. I could see while I was just flipping through right at the beginning when I read Suman Murarka, she has a question that probably almost every possible parent at the moment is asking: how to boost immunity in kids? That we have. Uh, is there a medicine that we can give that simply the immunity of the child can be boosted? Any magical dose that you can recommend that immunity can be taken care of?
Yes. As regards immunity, everybody is asking the same question.
Okay.
What about immunity? Let me first of all make it very clear that immunity or no immunity, this
Right,
coronavirus is spread via droplet infection.
right,
When a person is infected and
right,
he coughs or sneezes or he speaks,
right, right,
then he releases droplet infection, droplets.
right,
And if you are in contact with that person, close to that person,
right, right,
then that droplet infection can go inside.
right,
So
right,
even if you are immune,
right.
you will have to maintain social distancing.
Okay,
That is the answer. That is has to be maintained. There is no way, no
G,
way. Social distancing is a must. Now
right,
again coming to immunity,
G,
there are no clear cut any tablets or capsules that we give and I can say you will be immune.
right,
First
right,
of all, let me tell you the topmost this immunity booster
right,
is healthy food, balanced food at
right,
home, homemade balanced food.
right,
By balanced food, we mean carbohydrate, protein, fats, vitamins, minerals, trace elements,
right,
fibers,
right,
water,
right,
water,
right,
adequate water.
right.
This is at the top most immunity booster.
Okay,
So many, then adequate sleep.
okay,
During
okay.
sleep time, you sleep adequate. Adequate sleep is very important.
All right, right.
Then hydration, adequate
Okay,
hydration. You take plenty water and fruit juices
right,
in plenty so that hydration is okay.
right.
Again, your this physical activity. You
Okay,
must be physically active.
okay, okay,
During
okay.
lockdown period also it's very important. If you are more physically active, you
Right.
are more immune.
Okay.
Then then you should not suffer from any anxiety.
Right.
Because if you are having anxiety, then you will be less immune. That I think you will explain. Then,
Dr. There was a proverb that we have all grown up with, that healthy body has a healthy mind. I think we can change that proverb now, listening to you, that healthy body is an immune body.
yes, yes. And again, going to the just answering the question which Suman Murarka asked,
Right.
we can give vitamin supplements.
Okay.
Supposing B complex, vitamin C.
Right.
Then, if we are a child is deficient, we can give vitamin D,
Right.
vitamin B12. What we know, B complex, vitamin D, vitamin
Right.
B12, vitamin
Right.
C, vitamin
Right.
E.
Right.
All these, no, these vitamins we can give. We can give adequate protein,
Right.
adequate water. I explained you. So we can give vitamin supplements. There is no harm in it. But
Absolutely.
if the child or the person is not deficient in any vitamin,
Right.
then
Right.
extra vitamins are not going to help.
Okay. Okay. Your vitamins will help only if there is a deficiency. Otherwise, body
Yeah.
anyways have the sufficient amount.
Yes, 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 yes.
Okay. Doctor, I think you beautifully pointed out that there is no medicine that can be given, there is no pill that can be given for immunity, but there is a lifestyle and patterns that needs to be looked at that can strengthen immunity. Dr. Saab has talked about some natural things, that healthy things in terms of the eating habits of the child is going to help boost immunity, and also very important point uh, is about the sleep cycle of the child or any individual. Adequate sleep is, if there is not, if the individual is not getting adequate sleep, and I'm emphasizing this point, चूंकि इस समय लॉकडाउन है, ऑफिसेज बंद है, स्कूल बंद है, तो हम सबका एक स्लीप रूटीन मन मर्जी का हो गया है, हम मन मौजी रूटीन पर इस समय आ गए हैं। रात में देर तक जगना, दिन में सुबह एक डिफरेंट टाइम पे जगना। फ्रेंड्स, लिसनिंग टू डॉक्टर साहब, आई वुड लाइक टू एम्फसाइज, आपकी जो बॉडी क्लॉक है, आपको एक सोने के टाइम पे सोना और जगने के टाइम पे जगना बहुत जरूरी है, अगर आपको अपनी इम्यूनिटी को स्ट्रेंथन करके रखना है। और क्योंकि आपकी बॉडी क्लॉक उसी हिसाब से ट्यून्ड है। आप रात में 3 घंटा सोएंगे और दिन में 6 घंटा सोएंगे, तो आपको आपकी बॉडी को उतना सुकून नहीं मिलेगा, और कहीं ना कहीं शरीर आपसे सवाल पूछेगा और कहेगा मैं क्यों इम्यून रहूं अगर तुम मेरे साथ if you're not taking good care of me by giving me adequate rest and sleep. Dr. Saab also pointed out very important aspect is the proper hydration, and that is going to be very, very important here. So, friends, and he also said a lot of vitamin supplements can be given. So, if a child has a deficiency, it is going to help. But then, if a child already is having sufficient intake of vitamins, these supplements are going to be not much of will not make so much of a difference. Otherwise, of course, it can be a good idea. Doctor, before we go on to the next question, I can see there are some more comments and statements. We have Nisha Khatri, Surbi Rani, Sushma Kejriwal. We have Sunita Arora ji. She's the principal of Delhi Public School, if I'm getting it right, and Delhi Public School at Havana. And this school also right now is officially running the watch party for their parents. And she is writing here, connecting to what you said a little while back, getting back to our roots of removing the shoes before entering the house, washing hands and doing namaste is going to be a new norm. And we need to communicate these values fervently to our children. I think what you said a little while earlier, कि हम लोगों को जो दादाजी लोग नुस्खे देते थे, जो पहले हमारे अंदर संस्कार डाले जाते थे, I think Sunita ji is further emphasizing on the same.
Yes, yes.
Doctor, this brings me to a question. When you talked about hydration a little while earlier, I would like to ask, आजकल ये चर्चा में आ रहा है कि गर्म पानी पिए, that is going to be better for the body and for the immunity than the normal regular cold water or room temperature water. So what is your opinion on that?
I'm just touching here that there are Ayush guidelines.
जी, जी,
Ayush Ministry guidelines
जी,
by our homeopaths, our naturopaths, our alternative medicine guideline is there.
जी, जी,
They have advised to take warm water. They have advised to take kadha.
right,
They have advised to take certain spices and
right,
say long elaichi, adrak, like that. They have advised to take golden milk, say
right,
twice a day. They have
right,
advised to say oil pulling therapy once or twice a day,
right,
putting oil in the mouth and swishing it. Then
right,
they have advised just put oil in the nose.
right,
So they have advised so many things. So my take on these things are, number one, as an allopath doctor practicing allopathy,
right,
I don't subscribe that warm water will help,
right,
because our body temperature is 36 to 37
जी,
degrees centigrade, or say 98.4 maximum. This temperature is body surface temperature is there. So
right,
whatever goes inside,
right,
it adjusts to the body temperature,
right,
whether
right,
it is hot or cold, doesn't matter.
right,
And it has been established that corona, it's not that by heat or by sunlight that corona goes away. It's not established,
right,
but
okay,
we must respect our traditional thinking. So
okay,
if anybody is advising garam pani, it advising say kadha, so
right,
they are supported by scientific evidences,
right,
and they have advised.
right,
Our ministry has taken guidelines from scientific advisors only,
right,
qualified people also. So there is no harm in following all these things,
right,
because if we do not have any vaccine against the disease,
right,
if we do not have any medicine against the disease, and
right,
if it helps us in
right,
boosting our immunity, people
right,
are saying to take Chavanpras. They have
right,
advised in Ayush Ministry that
absolutely,
those without sugar they can take Chavanpras, diabetic person, or
right,
with sugar they can normal. Without sugar they can normal Chavanpras. So
right,
my take on this, all these kadha Chavanpras are providing your trace elements and
right,
vitamins that are
right,
needed for the balanced diet. I think
right,
so.
right,
They are providing more of them. So they are
right,
supplementing in a way what is
absolutely,
needed for immunity.
immunity.
So in that way, I am this supporter of integration of medical sciences. You follow whatever is advised for the treatment by any ministry or any pathy.
And as you quite rightly said, Doctor, that Ayush, as part of the Ministry of Government of India, is providing these guidelines, and we have different pathies, and every pathy has their way of looking at it. And you quite rightly said that right now as till we get the final answer and the final verdict on Corona, we'll have to go with integrated approach of
Yes, yes.
being eclectic about our methods. And I think if ever the preventive medication was the need, it is the time is now. I mean, because we don't know what the treatment for the disease is, we need to go more preventive about it. And whether it is lukewarm water, whether it is Chyawanprash, whether it is Tara, definitely they are all immunity boosters, and they will help us be preventive, if not curative, about the whole thing. So I think it will be so steam inhalation and lukewarm water, kadha. I think one should keep on taking, because that strengthens the immune system and can, if not curative, will definitely be preventive for all of us. Doctor, we have uh, the Harsha Bagla here raising a question that in terms of getting back to normal, even when schools open, how do we get the confidence to send our kids back to school? So government will take the decision, schools will take the decision, parents will take the decision. But I think it's a very significant point for every parent. अगर कल को लॉकडाउन खुल भी जाता है और schools को open होने की guideline, अभी तो online education is becoming the buzzword and everyone is following that method. तो अगर एक बार को स्कूल खुलता है तो हमारी पेरेंटल एंजाइटी बच्चों के लिए तो रहेगी. So I'm repeating the question for emphasis. Very significant question for a lot of parents. In terms of getting back to normal, even when schools open, how do we get the confidence to send our kids back to school?
Yes. So now till the time this pandemic subsides,
Okay.
we cannot be adventurous. We should
Right.
not we should not think of sending our children to school, and I think schools will definitely will not allow
Right.
till the pandemic persists.
Right. Right.
And once the pandemic curve goes down or pandemic slows down,
Right.
then school authorities have to convince that they
Right.
have followed the proper protocol
Right.
so that it can be COVID free or it can be say COVID proof protocol.
Right.
Supposing
Right.
you will have to maintain distancing whenever it
Right.
opens, even after
Right.
pandemic subside and schools are open,
Right.
then social distancing norms has to be followed by the school authorities.
Right.
And it is 6 to 8 feet distance between students has to be there.
Okay.
No gatherings,
Right.
no
Right.
playing together of this students.
Right. Right.
You
Right.
got my point. These are the things. Then sanitization of the
Yeah.
school premises and
Right.
this sanitization of the frequently touched
Absolutely.
objects and surfaces, whatever it
Right.
is, school
Right.
tabletop or
Right.
laptop or whatever
Right.
gadgets the students are carrying.
Right.
They will have to follow at home the guidelines, and the schools will have to follow the guidelines at school also.
Right.
And I
Right.
can assure this online education is going to be there for quite some time. I think so.
Absolutely.
I
Absolutely.
think so. And you are better. You are better. You can
No, no,
comment on this.
Dr. You have beautifully said it in very simple words. I think till the time pandemic is controlled and we get the government guidelines, uh, we should not get unnecessarily adventurous about things and schools. I think online education is what parents have to start valuing and respecting more. I think every school has made headway and evolved into providing the best possible service to the student so that their learning and education continues. I think parents will have to respect and honor that and consider that as a mandate till the time pandemic subsides. But yes, I also know that as gradually schools are also thinking about providing all those facilities for sanitation and hygiene and that sanitizing tunnel and all those things will surely come up when before the schools open to make them so-called corona proof or COVID proof
Yes.
absolutes. I don't think can be achieved unless the treatment or the vaccine is found. But yes, I would say, Harsha ji, you or all the parents, you respect the online education. Teachers are putting in a lot of effort for providing the continuity to the learning of your children. And as doctors have advised, we need to be cautious and not get adventurous till we get appropriate government guidelines and go ahead to go with the same. And I'm sure government will only say go ahead when they will be sure that things will be in control. So stick to that and confine to government norms and government dictate. We have a question from Anup Fatehpuria, uh, which is, this virus. Before I read this question, I'll just give a little background because that's what we have been hearing and observing. बहुत सारी इस तरीके की शुरू में बात आई सुनने में आया जब WHO ने भी कहा कि not to worry and we carried on and then WHO said no, it is something to be worried about. We went on to the lockdown and we said it is only through surface contact, not through air. Now lately there is a lot of the WhatsApp information news channels are
Mhm.
broadcasting every time, and now a new fact that pops up. And one of the recent pop-ups in the context is can virus travel through air as well?
Good question, and very difficult to answer. This is a
Right.
very rapidly changing sscenario. Very
Okay.
rapidly changing scenario. As you
Right.
already highlighted, WHO
Right.
also
Right.
initially could not. gauge the severity of the situation.
right, right,
And still, there are so many things which are unclear
right,
as regards corona is
right,
concerned.
right,
What we know that it is a droplet infection,
right, right.
and droplets can go far,
Mhm.
not more than 8 feet or 7 feet, 8 feet. They can't go far. Number
Right,
one.
right.
Number two, these droplet infections can be on surfaces,
Okay,
supposing floors, tabletops, or whatever you are using.
right,
There again, researches are on some surfaces it is for hours, on
right,
some surfaces it is for days. I don't
right,
know. We
right,
should not go into the details of that. Currency notes having this one virus,
right,
coins having virus,
right,
then your day-to-day usage surfaces are having virus, no? Plastics,
right,
then metals, then clothes.
right.
On this virus is there. So
So,
there are timings, hours to days. Maximum
right,
they have said they can be for 5 to 6 days on the
right,
surfaces,
right,
on the surfaces and objects.
right,
They have said it can be maximum 5 to 6 days, or it can be hours.
right, right,
And as regards droplet infection is concerned, they are not supposed to go beyond 8 feet, max to 8 to 10 feet.
right,
So, and as of now,
right.
it is not in the air. It is
As
not
of
in
now, it is
the
not in the air.
not in the air. I don't know if the evidence comes out. A community transmission is the initially there was no history of travel was there. Now
Right,
the no history of travel.
right,
Initially there were contact with the infected person was must.
right,
Now we are seeing cases, asymptomatic cases. They
right.
do not have any contact with the symptomatic cases. So I think the scenario may change.
All right. So I think what Mr. Bagla, Mr. Fatehpuria asked is a question about uh, does it transmit to the air? As Doctor pointed out that this particular virus has kept all intelligent mind quizzing all the time because we all nobody knows the nature as yet. The researches are on till anything comes up with finality. We have to be cautious about almost everything. So far, there is no validation officially that it can be airborne uh, there, but then viruses have a basic inherent nature. They mutate almost every virus. So
Yes.
what is there today? Maybe there may be some other patterns that can be seen after 15 days time. So I hope I'm saying it right, Dr. Sab. I dare to.
Yes, yes,
Yeah,
yes. Let me, in this context,
right,
let me tell you that I told you that children are less affected,
right,
symptoms are mild, but
right,
as because the rapidly changing times, 2 days back, only say 2 days back in New York,
right,
more than 70 kids
right.
below 5 years,
Okay,
four of them died.
right.
They
Okay,
presented with the symptoms of a disease called Kawasaki disease.
okay. Kawasaki disease.
Yeah, it is a
Okay,
type of autoimmune disorder affecting kids
okay,
less than, and it is a deadly condition, very
okay.
critical. It takes, if it
Right.
survives to 3 to 4 days, it takes to recover, if
Okay.
anybody recovers. So this Kawasaki disease, more than 70 kids were having Kawasaki disease, and
Right.
all came out to be corona positive,
Okay. Okay.
and they were not having symptoms of corona. They
Okay.
were having symptoms of Kawasaki disease,
Right.
but they were not having symptoms of corona, say running nose, cough and cold, and like that.
Right. Right.
So might be some mutation has happened, might be.
Might
So
be.
it is a rapidly changing scenario.
So
It is a
caution
very
and
rapid.
prevention is the only way out.
Stay informed.
Right.
Stay informed.
Stay informed. Keep updating yourself
Yes.
regularly from the right sources.
Yes. Yes.
Right. We have Rekha Singh ji here. Good evening, Amitabh sir and Dr. Kejriwal. Indeed, a very informative session. Rekha Singh ji is the headmistress of the Jain International School in Kanpur. This is one of the school which is right now simulcasting our show, the Jain International School in Kanpur. Thank you, Rekha ji, for acknowledging the informativeness of this session. We have Shruti Luthra Sudera. My son is prone to tough and cold since he is born. In fact, he was admitted to severe bronchitis when he was 40 days of age. At present, he is 3.5 years and is on puffs already. And he still catches cold and cough very fast. What can I do to improve his immunity? As this time, I'm very scared with corona.
Yes. So just you, first of all, you try to, if a child is having any symptoms of cough and cold, then whatever your consultant is advising you, follow that.
Okay,
Because you must control the symptoms and signs,
right,
control the disease process, number one.
right,
Number two, the same precautions
right,
we take for normal other children, we will have to take for him also.
okay,
Supposing social distancing, wearing of mask, frequent hand washing,
right,
and disinfecting or sanitizing frequently touched surfaces or objects.
right,
So these precautions, and as regards immunity is concerned, I've already told you
right,
what we should do. It applies to him also. But
okay,
if any medication he is taking, long-term medication, puff, he must
right,
continue judiciously.
okay,
He must not
okay,
discontinue whatever medicine. Supposing
right,
even if the child is taking steroid puffs,
right,
then also he should continue with that.
okay,
Whatever medicines is advised are advised by his consultant or her consultant,
right,
she should continue with the medications.
okay, okay, okay,
So she should continue the disease in check, disease process in check,
right,
and all the precautions applicable to other children or other persons are applicable here also
right, right.
regarding immunity or precautions, whatever you can take.
Okay. I think very important part in context of the query asked by Ms. Shruti Luthra Sudera that if the child already has some identified line of treatment that is going through for any ailment, that should be religiously followed and should not be deterred, because we are talking about, we don't know about corona, but we definitely know about that particular disease, and the medication given for the same will ensure that that particular thing will not aggravate and disturb the immunity and making the child vulnerable to corona susceptibility. I think that's how I look at it. And that is why the medication, whatever prescribed by the uh, your child's consultant, pediatrician, or the doctor, please adhere to that religiously. And any change should be done only on medical advice, not on your own personal change. And otherwise, follow all the Ayush guidelines for strengthening the immune system of the child alongside. We have a lot many more people joining in, Dr. It seems that there are a lot of concern of जहाँ जहाँ बात बच्चों की आती है, माँ बाप को कुछ और नहीं समझ में आता है, which is very very natural. And so there are a lot of queries which are being put up. We have a lot of people appreciating Neelu Kejriwal, Lal Bagla, Subal Muralka. We have Mikhabi Chokani. Her question is, my son has an allergy to certain things, which leads to excessive sneezing and watering nose. Does this mean he has low immunity?
No, it
Okay,
doesn't mean that he has no immunity.
okay,
If somebody is allergic to something,
right,
that doesn't mean that he has got no immunity.
all right,
He is allergic to some things, and we have to avoid those things which he is allergic to.
right. So allergy is
And
not naturally an indication that is not a direct correlate with the immunity
yes,
of
yes.
the person. There can be so many other factors responsible for the child being allergic to it. So one should be cautious of those things to which.
And as regards your running nose and this, what you said, na, running nose and sneezing.
Right, and in
I
fact,
told you.
this reminds me of a lighter vein interaction that I had with you before we went live. And friends, I was just saying to Dr. Saab after learning a lot of things from him that that means that if your child is sneezing or you are sneezing in the current time, that's a good news, because that reduces the possibility of the cold and cough to be closer to corona, because sneezing is not a symptom of corona,
No, no, sneezing, man, regular watery nose or sneezing
right?
are likely. Man, corona is more aggressive. I told
More
you, na,
aggressive,
fever,
right?
high fever, dry cough, incessant, more aggressive. It
Okay.
is not milder like this. So that way she can be assured.
So you can be more relieved if the child is sneezing, and of course, don't get casual. Prevention is very important. So immunity is not what you need to worry about. If the child is just allergic, Meghavi Chakani ji. Nisha Murarka says that if a child uh, is having past history of asthma, how to take care of it, and at this harvesting time, child is already having wheezing and sneezing along with coughing.
Good. So what I earlier told you that she should continue with the regular medications advised by her physician.
Okay,
So that things do not get out of hand.
right,
She must be particular about any person at home having
right,
flu-like symptom
right,
should not come in contact with the child.
right, right,
It is better that the child also wears mask
right,
because he is probably more than 2 years
G,
wears mask so
right,
that any infection he does not spread to other people.
right, right,
So you will have to maintain social distancing, then
right,
hand hygiene, hand washing, hand hygiene,
right,
sanitizing objects,
right,
and whatever medicines you are taking, you take. And if you are fearing that the things are aggravating,
right,
then normal, then what is normal? If they're aggravating, then what is normal? Then you must consult your pediatrician.
pediatrician. Okay. So that's very important that follow the necessary precautions. Otherwise, contact your pediatrician for a consultative detail. And I'm taking your advice, Doctor, of keeping
Yeah,
myself
yeah.
hydrated. We have
Hmm.
Rajesh Sharda asking a question: any vaccine required? Sharda ji, I don't think that there is any vaccine specifically for corona as yet found out, but still I'm throwing this question to Doctor.
Yes. I am just throwing another question
Right,
that Corona doesn't have any vaccine,
right,
but whatever vaccines are available,
right.
parents should see their chart that how much they have complied with those vaccines.
Okay, okay. That is very very important.
There are more serious illnesses than corona, poliomyelitis,
Right,
measles. They are
right,
taking pneumonia, they are causing pneumonia, they are causing encephalitis.
right.
So many dreadful diseases.
Absolutely.
And I think some of them has complied, but they are not complied with full compliance is not there.
Okay,
Number
so
one,
that should be
you,
taken care of.
that should be taken care of. Number one,
Right,
Corona does not have any vaccine, but if the child has taken regular vaccine,
right.
then he is protected. He is a
Okay.
protected child in a better position to fight Corona.
I think the immune system will be stronger if
Yes,
the
yes. And as regards Corona vaccine is concerned, at
right,
least more than 100 trials are going on
right,
by
right,
WHO, by CDC, by Indian companies also.
right,
And sooner or later, the vaccines are going to come.
right,
So,
right.
at least till the time vaccines are coming, we must take precautions advised by our government and statutory authorities.
I think that's a very, very significant point that Dr. Abed highlighted, friends, that कोरोना की वैक्सीन नहीं है लेकिन बच्चों के लिए एक वैक्सीन का एक साइकिल है जो बच्चों को बहुत सारी बीमारियों से बचा के रखते हैं एंड सवाल ये है कि क्या आपके जो रिक्वायर्ड वैक्सीनेशन हैं जो अवेलेबल वैक्सीनेशन है बच्चों के लिए इन ग्रोइंग ईयर्स क्या वो बच्चों को टाइमली मिले हैं कि नहीं मिले हैं और क्या कुछ ड्यू हैं बिकॉज that would act as a major preventive cycle because right now we are talking about comorbid symptoms. We are saying अगर कोई और बीमारी है तो कोरोना
Yes, yes.
बैटल हो जाता है तो अगर बच्चे ने बाकी चीजों की वैक्सीन ली हुई है या अभी अगर ड्यू है तो वो ले लेते हैं तो शायद they will be stronger to face the current crisis that we are going through.
Just for parents' information, I
Right,
just want to inform parents that
right,
Government of India, WHO, CDC, all the bodies, even during lockdown period,
right,
has advised
right.
that parents can take vaccination.
Okay, okay,
At least primary vaccination that are taken during birth or
right,
during first year of life, say 6 weeks vaccination, 10 weeks, 14
right,
weeks,
right,
6 months flu vaccine, measles vaccine, 9 months, chickenpox
right,
vaccine. then
Right.
Japanese encephalitis vaccine, they've advised and they are allowing the parents to
Right.
take vaccines. And pediatricians have kept open their clinics for
Okay.
vaccination purposes.
Okay. Okay.
There are guidelines. There are guidelines to be followed by parents,
Right.
and there are guidelines to be followed by the doctor in their
Okay.
clinic.
Okay.
So,
Okay.
if those guidelines are being maintained,
Right.
then I think parents should go for the immunization, their pending immunization.
I think that's doctor, this is reminding me that pre-corona days कभी कभी हम भी casually ज्ञान तो बघार देते थे लोगों को एग्जाम्पल देने में when it used to come, and one of the things that we used to share, हम कहते थे कि मेडिकल साइंस की अगर बात करें तो जब हमको वायरल फीवर होता है तो हमको एंटीबायोटिक रिकमेंड की जाती है, तो एंटीबैक्टीरियल वायरस को तो मारेगी नहीं, बिकॉज एंटीबायोटिक इज एंटीबैक्टीरियल, तो इलाज हम वायरस का तो करते ही नहीं है क्योंकि वायरस तो अपनी मौत मरता है। हम शायद वो दवाइयां इसलिए देते हैं एंटीबायोटिक कि सेकेंडरी इन्फेक्शंस की पॉसिबिलिटी, क्योंकि
Yes,
वायरस लगने से जो हमारा सिस्टम वीक हो रहा है उससे सेकेंडरी इन्फेक्शन लगने के चांसेस हैं। और अभी जो
yes,
आपने इम्यून ये वैक्सीनेशन की बात करी, मुझे लगता है आई एम ट्राइंग टू ड्रॉ अ कोरिलेशन कि ये जो हमारे नॉन वैक्सीनेशन है बच्चों के लिए, अगर वो बच्चों को टाइमली दिए जाएंगे अभी भी, तो उनका जो सिस्टम है वो कोमॉर्बिडिटी से बच्चों को प्रिवेंट करेगा, एंड जिससे कि उनको और स्ट्रेंथ मिलेगी, एंड आई थिंक दैट इज गोइंग टू बी very very important, and Dr. Saab has already said that the government is giving the guideline that immunization to go on. But before I take any further questions of my viewers right now, एक सवाल मेरे जहन में आया है, एंड यहाँ पे मैं थोड़ा सा आपसे इजाजत चाहूंगा डॉक्टर साहब, पता भी नहीं चला कब की 1 घंटे हमारे इस
oh
कन्वर्सेशन के
no,
हो चुके हैं।
oh
So
no,
do I have
no.
your permission to extend my
Yeah,
5 minutes?
yeah, yeah,
Take,
yeah, yeah.
and I'm sure it is something very very relevant and sensitive for the viewers, and everyone is here very keen listening to you, and I'm sure आपको
I
भी
just
इस समय में पकड़ना मुश्किल है, so I'll draw a benefit of your presence here. मतलब यहाँ पे एक सवाल मेरे जहन में आ रहा है, as a neonatologist, that's your forte as well. बहुत सारे हमारे पास अभी कुछ दिन पहले there was someone whom I counseled about 15 17 years back as a youngster, who is a mother, husband wife, settled in Birmingham, sorry, one of the countries outside India. He called up from there and very anxious. We fixed up an appointment for counseling 12:30 in the night, and had a 3 hour long interaction. The issue was that it's a I'm a severe stress and anxiety. I said, why? She was pregnant in the 9th month, and
okay.
they were in a lockdown, and she just had a fever a day before when she called me up, and she was extremely worried, not just for her but for the child. If she gets infected, will she infect the child? I'm extending the question further. Will how safe is a newborn child? How safe are the deliveries in the COVID times? I think these would be very important queries that is going to be in many people's mind.
Yes. Number one, as of now, mother positive mothers are not transmitting COVID to their newborns.
Okay, okay,
There is no evidence
okay,
that the virus is being transmitted from a pregnant mother
right,
to the newborn
okay, okay,
because the virus has not been found in
right,
amniotic fluid,
okay,
in placenta,
okay,
in vaginal fluid,
right,
in breast milk.
right,
Particularly amniotic fluid and placenta, the virus has not been found.
okay,
So,
okay,
for on that account, you can assure the mother that she is
right,
not going to transmit the virus
okay,
to her newborn.
right.
Number
Okay.
one. As
So
regards,
as a expecting mother, God has given you enough strength as a mother to protect your child, the fluid inside. So far, there are no evidences of mothers transmitting it to the baby in they are carrying.
having said that, the
Okay.
mother must take due precautions,
Right.
advised for other people,
Right.
and in a more stringent manner,
Right.
so that she doesn't get infection.
So they should quarantine themselves without any
Yes,
symptoms and protect themselves
yes,
from getting the symptom.
yes. Again, now deliveries.
Right,
Institutional deliveries in
right,
consultation with the gynecologist obstetrician,
right.
where the protocols are being followed,
Okay,
there is no issue. You can go
okay,
for that. Where
okay.
all the protocols are being followed,
Right,
whatever is advised at
right,
this time, I
right.
think there is no worry on that part.
Okay, okay.
Number three, so many mothers asked me whether I will go for cesarean, should I go for normal delivery. On that count also, I
Right.
just want to assure them that corona has got no relation with the type of delivery.
Okay, okay.
It will be normal delivery or it will be cesarean delivery will be decided on other factors
Okay.
as per your doctor's choice, other
Right.
other other conditions not related to corona.
Okay.
And
Okay.
once you deliver the child, and even if you are COVID positive,
Right.
you are allowed your child in your lab, in your contact,
Right. Right. Right.
and you can breastfeed your child. Just
Okay.
put a mask yourself, and just keeps disinfecting regularly touched objects and surfaces,
Right.
and avoid contact with other people in the family.
Okay. Okay. So I think if we follow the due protocol and the necessary precautions are taken, one need not worry about it much.
Yes.
Right. There is a question by Ishita Gomes. Sir, I wanted to ask about the vaccines and immunization due for children. I think that you already answered that. Is it safe to visit a clinic in order to get vaccinated
Yeah,
for
yeah,
small children?
yeah. What?
शी इज आस्किंग अभी आपने कहा कि इम्यूनाइजेशन करा लेना चाहिए सो छोटे बच्चों के लिए क्लिनिक जाना इम्यूनाइजेशन कराने के लिए हाउ सेफ इट इज
It is that's what I earlier said that you will
राइट
have to follow protocols, and
राइट
the clinics have to follow protocols.
राइट
Supposing you are going out of your home,
राइट
even parents have come to
राइट
me from containment zone also,
राइट
because I am practicing Howrah, I am practicing Kolkata,
राइट
and both are red zones,
राइट राइट
and people are coming from containment zones also nearby
राइट
buildings. So
राइट
what I advise them, you come in your own vehicle.
ओके ओके
Number one. Number two, don't come with grandparents and all. Na? You either come alone or with your this hubby, na,
राइट
father.
राइट
Whatever discussion you want to do with me,
राइट
you do over telephone.
राइट
You will be coming, and
राइट
I will be only giving the vaccine, and
ओके
all these things will be over telephone and teleconsultation.
राइट राइट राइट
Minimum touch,
मिनिमम
and
टाइम राइट
minimum coming in contact with any other person.
राइट
Again,
राइट
I want to assure all the parents that
राइट
corona infection is a droplet infection. It
राइट
does not go beyond 8 feet.
ओके
So, whatever region you are coming, if you are maintaining proper social distancing with the persons around,
राइट
then I think you are safe.
Okay, okay. I think that answers the anxiety. That's why we have Akhilesh Singh asking a question that my daughter is an athlete and had a routine of 6 hours of physical activity. 6 hours of physical activity, which has come to a standstill. Have seen mood swings. Could you please suggest how to keep her morale high?
Yeah, yeah, yeah. What she
अ,
said?
अखिलेश सिंह जी का कहना है कि उनकी डॉटर एथलीट है और करीब बिफोर लॉकडाउन 6 आवर्स का शी यूज्ड टू हैव अ फिजिकल एक्टिविटी और अभी ऑल दोज एक्टिविटीज कम टू अ स्टैंड स्टिल फिजिकल एक्टिविटी और जब से वो घर में स्टैंड स्टिल हुआ है फिजिकल एक्टिविटी कम है उनके मूड स्विंग्स बढ़ गए हैं और सो दोज काइंड ऑफ चेंजेस आर बीइंग सीन सो व्हाट एडवाइस यू वुड गिव टू एन एथलीट who has become
Yeah.
passive.
Those who were not doing any physical activity before lockdown,
Right.
at home, they are going beyond limit.
Okay.
They are doing physical activity or extensive workout
Right. Right.
at home. So as because she is an athlete, child is an athlete,
Right.
she can do whatever she wants at home.
Right,
She
right,
must be knowing what athletic workout she was doing.
right,
I
right.
think she can do in some modified form at home
Modified
also.
forms. Uh,
And
and Akhileshji, along with Dr. Saab's advice, as a psychologist, I would like to advise that जो डॉक्टर साहब ने बात कही कि जो फिजिकल एक्टिविटी का जो एक रिदम था एक और जो सडन लल है और एक रिडंडेंसी है जो कि मसल मेमोरी भी उसकी इस समय उसको अफेक्ट कर रही है और जो वैक्यूम है हाउ टू स्पेंड टाइम वो उसके साथ एडअप हो रहा है hence the mood swings is what you are experiencing. I think there has to be a routine for getting a little more varied schedule as Dr. Saab has pointed out for your child and some other aligned constructive activity plan to be worked out to keep her involved. She will be absolutely fine. We have Shiv Kumar Lohia ji asking a query. Doctor, we have one child of 9 years age. It is said that the COVID has mild effect on children. Is it true? Also, please inform intake of zinc and iron.
off?
Of zinc and iron.
Okay, okay.
Right. Intake of zinc and iron. Is it advisable?
I already said that children have got mild symptoms.
Right.
So
Right.
on that aspect, I have already told.
Right.
As regards supplement, I
Right.
told I'm just telling people are taking iron supplement, they are taking zinc supplements,
Right.
they are taking vitamin C supplements,
Right.
some people are taking vitamin E supplements.
Right.
And I already said that these all these natural items, what we are taking, kadhas and haldis,
Right.
in my science, I take it that they are having vitamins and trace elements and
Right.
minerals, whatever is required.
Right.
So there is no harm in taking this iron supplements or say vitamin C supplements or zinc. Zinc also boosts immunity.
Okay. Okay.
But you must not be that if it is not there,
Right.
you must not worry because if you are having balanced food
Right.
and you are not deficient in all these things
Right.
and you are following everything judiciously, whatever advised by Ayush guidelines or whatever advised with, then why to add more tablets?
That's very true. I mean, it is anything be taken only when it is needed. Too much
Yes.
of an excess of anything may not give you any benefit. Doctor, I'll take just one or two questions to end because I think अगर हम लोग extend करते जाएंगे तो आज के इस show का इस episode का अंत नहीं होने वाला है. But I think it's very natural for people to be anxious. We have this question from Sadhna Pandey. She is, if I'm getting it right, is the principal of the school, the Jan Word School in Mati in Uttar Pradesh. And this school is also right now is doing a simulcasting of Watch Party of our Infraction. Good evening, sir. How to differentiate between a common cold and coronavirus? What we can do to, as a school when it's new normal? I think, Sanaji, this question has already been answered a little while earlier. I think after the episode, if you play it back on the page, you will get the details. We have uh, you know there's I'll take this as probably the last question today, Dr. Saab, and that is Jitendra Singh is asking, sir, and I think this is one of the very natural and very honest and question that many people have in their mind. So how many hours coronavirus stay in human being?
How many?
Hours that कोरोना वायरस थे. मान लीजिए हम कहीं गए हमने किसी चीज को टच किया तो हमारे हाथ पर वायरस कितनी देर तक लास्ट करेगा या किसी भी ऑब्जेक्ट पे how long does it survive? He's asking specifically on human beings.
Yes, yes. So what I said earlier that virus without any food
Right.
cannot survive for long
Right. Right.
because viruses are in itself for food they are dependent on the host.
Right.
They will enter the host, they will enter their cells,
Right.
and they will utilize the host cell or host factory
Right.
to replicate itself.
It's absolutely
So
absolutely
whatever hours I told you that on plastics, on skin, or say on currency. There are so many theories that it is for hours,
right,
it is for days. Maybe maximum they have said 5 days. But
right,
I don't think that it lives so long without any host or without any nutrition.
जी,
And still the guidelines are na, if we follow the guidelines, there
right,
is no reason they stay on our skin for long. If we
absolutely,
follow the guidelines we just discussed,
right, right,
so even if by chance that in future it is till they can survive on skin for 10 days, for months, but you are
right,
following the guidelines, the
right,
distancing, hand washing, taking baths, only
right, right.
simple soap and water gets it,
In fact,
destroys the
Doctor,
bacteria.
that rouses the natural lighter vein query. Though issue is very serious. वो चीज वो वायरस जो छोटे से साबुन से 20 सेकंड के अंदर मर जाता है वो क्यों इंसान के लिए इतना फैटल और इतना डेंजरस बन गया
क्योंकि इंसान समझना नहीं चाहता है, अपनी लाइफ स्टाइल चेंज नहीं करना चाहता है।
राइट
हाँ, each and every citizen of India
राइट
is to be educated,
राइट
particularly at this time,
राइट
about social distancing, hand washing, and wearing of mask.
राइट
If three things we can follow, I
राइट
think pandemic will not stay. Pandemic is going to disappear.
आई टोटली एग्री विद यू और एक बशीर इफ आई एम नॉट मिस्टेकन बशीर बद साहब का एक शेर याद आ रहा है कोई हाथ भी ना मिलाएगा जो मिलोगे गले तपाक से कोई हाथ भी ना
हाँ,
मिलाएगा जो मिलोगे गले तपाक से नए दौर का शहर है जरा फासले से रहा करो
good, good, good,
आई
good, good,
थिंक
good.
हम सब लोग एक नए दौर के जमाने में हैं नया दौर है और सिंपल सी चीजें हैं जो हमारी जान को बचा सकती हैं health health nowadays is in the hands of hygiene तो अगर आप
Yes.
हाइजीन फैक्टर्स को ध्यान में रखेंगे तो आपकी हेल्थ स्ट्रांग रहेगी डॉक्टर साहब आपने आज हमारे इस एपिसोड में आने के लिए वक्त निकाला लोगों को इतनी कॉन्क्रीट जानकारियां दी बहुत ही सिंपल शब्दों में लॉट ऑफ अप्रिसिएशन एंड थैंक यू नोट आर ऑलरेडी कमिंग ऑफ पीपल आई वुड रियली लाइक टू थैंक यू तहे दिल से आपका शुक्रिया है कि आपने तमाम पेरेंट्स को तमाम यंगस्टर्स को तमाम लोगों को जो इस समय सुन रहे थे और बाद में भी सुनेंगे we will be putting it up on our YouTube as well. I think this is going to be a good reference for young parents how to deal with Corona and help their kids. Thank you so much.
Thank you, thank you, thank you, Amitabh. Thank you,
Thank
thank
you
you,
so much, Dr. Shah.
thank you, thank you.
फ्रेंड्स आई होप आपने आज के एपिसोड को एंजॉय किया होगा डॉक्टर साहब की जो स्माइल थी आई थिंक गिवन टाइम पे वो अपने आप में एक पॉजिटिव एश्योरेंस था इतने स्ट्रेसफुल टाइम में एज अ डॉक्टर he still could maintain such a strong smile throughout shows the strength and the character and the satisfaction that he's getting in helping people out बहुत सारे सवाल आप लोगों ने किए डॉक्टर साहब ने बहुत सारी जानकारियां दी फ्रेंड्स keep using all these information to your benefit. I'm sure अगर आपको कोई भी चीज आपने मिस करी है अगर आप इस एपिसोड में थोड़ा लेट आए हैं this is going to be available to you on our Facebook page. It is going to be available to you on the School Times YouTube channel, on the School Times web page. You are going to also get it on the School Times Instagram as well. आप किसी भी मीडियम से इसको कनेक्ट कर सकते हैं हमारा मकसद है इन लॉकडाउन टाइम्स में how to help you stay positive. And that is why we keep on bringing some eminent resource from across the country and beyond आपके साथ मुलाकात कराने के लिए उनके अनुभव उनकी नॉलेज को आपसे शेयर करने के लिए ताकि हम सकारात्मक रह सकें और एक दूसरे को हेल्प कर सकें और इसी कड़ी में हमारे अगले एपिसोड में 13th of May में we have another social influencer, educational influencer amidst us, connecting with us from Kolkata. Friends, we are going to have more than 3 decades of experience in education at the leadership positions, heading various educational institutions, and currently principal of Delhi Public School, mega city in Kolkata. Friends, I'm talking about Mrs. Indrani Sanyal, who's going to be our guest in our next episode on 13th. 4 p.m. Stay tuned to the school times and keep watching Ed Talks with Amitabh. फिर मिलेंगे, तब तक के लिए stay home, stay safe.